And you know what we have ahead of us? We're talking about Lung Cancer Awareness Month because that is what November is. And we are very grateful to have Dr. Christine Lovely, Associate Professor of Medicine at Vanderbilt Health, and Gina Hollenbeck. She's a 6-year survivor of non-small cell lung cancer. Gina, Dr. Lovely, thank you so much for being on AM Buffalo this morning.
Thank you for having us.
You know what, Dr. Lovely, specifically, we're talking about something this morning called genomic testing. Now, I have to start by saying, what is that? Because it sounds a lot like genetic testing, but this is something that can really help people. Can you explain?
Yeah, absolutely. And again, thank you so much for having us this morning to talk about this important topic. Genomic testing, also called biomarker testing, is where we look at the blueprints of the tumor DNA, to be able to ask what's driving the tumor to become a cancer and what's causing it to grow. And importantly, can we use that information to help us select for drugs that help treat our patients in a more precise, more personalized way?
That's really interesting. You know, there are different types of genomic tests out there, right? So knowing that there is first genomic testing, but also there are various different types, what should people know about this, and what should they be asking their doctors about?
Yeah, so I think it's very important for anybody who's a cancer patient watching, anybody who's a healthcare provider, a cancer patient advocate, talk to your doctor about biomarker testing. Has it been done on the tumor already? Should it be done? What information can we glean from that? Can it help us select for the best drugs? In lung cancer, we have multiple different biomarkers that we get from the genomic testing results that actually help us, again, to treat our patients in a more personalized, more precise way.
You know what? We are always floored by the latest research. It's always good to stay on top of what's coming out. And for a lot of folks out there, it only comes about, unfortunately, when these awareness months come around. But it's great to have you on right now to talk about this latest research, because it really is important to seek out the latest testing and the latest breakthroughs. Can you talk about that a bit?
Absolutely. There is so much progress going on in the world of cancer right now. It is just an exciting time to be part of cancer research, to be able to really afford better opportunities for our patients to live well, like Gina is with her cancer. We have research into new biomarkers, new testing, new drugs coming all the time. Really encourage everyone out there who's listening, who's a cancer patient or care provider, to talk to their doctor about testing, what trials exist, what new therapies are coming down the pipeline, because there's tremendous hope for all lung cancer patients and all cancer patients overall.
That is wonderful. Thank you so much, Dr. Lovely. And Gina, could you explain to us your experience with advanced lung cancer? Can you explain your diagnosis through treatment?
Sure. In 2015, I was 38 years old. I was training for a triathlon, working as a nurse, and I got the #1 cancer killer of men and women, lung cancer. And yet it is the #1 cancer killer. The statistics back in 2015 were pretty grim, but science and research is just evolving. And so I am one very, very lucky girl, because I had a doctor who knew to do comprehensive biomarker testing from the very beginning. He wanted to look at the DNA of my cancer, figure out what was driving it. I was someone who had absolutely no risk factors and no family history of cancer. So he wanted to figure out what was driving my cancer so that he could give me the very best medicine and personalize the treatment for me. And so I'm so thankful I was given that opportunity. And I think every patient should have the opportunity to have the DNA of their cancer looked at through comprehensive biomarker testing.
Gina, I'm so happy to hear about your experience. This is really wonderful, and I'm glad that you're able to share it with our folks here in Western New York, because they do need to hear about this sort of thing. And again, Dr. Lovely, thank you so much for being on AM Buffalo this morning. And if you would like to get more information about what Dr. Lovely and Gina are talking about, go to startwithstep1.com. Again, it is Lung Cancer Awareness Month, and we are spreading the word about genomic testing. Thanks so much, Dr. Lovely, Gina, for being on AM Buffalo again.